and today we're going to talk about exercise that can actually reduce blood pressure. So hypertension is a type of chronic disease which is basically when your blood pressure is elevated above 140 over 90 milligrams of mercury. Now this is quite a prevalent disease. In fact, it's called the silent killer because many men and women don't actually realise that they have it. It affects 7.5 million deaths per year. That's about 12.7% of all deaths worldwide. Research has shown that there is a correlation between the amount of exercise that you do and your blood pressure. So is there a drug-free approach to reducing hypertension? Well, yes, there is. The research shows that there is a relationship between exercise and hypertension. The more physical activity you do, the stronger your heart becomes. A stronger heart has to pump less hard in order to get the blood around the body. And as that happens, the pressure within your arteries decreases, lowering your blood pressure. So by becoming more active, you can actually lower the systolic blood pressure. That's the top number that you read on a blood pressure. And you can reduce that by 4 to 9 milligrams of mercury. And that's as good as some medications will do. And if your blood pressure is already at a desirable level, then actually engaging in physical activity means that you don't have a rise in blood pressure as you get older. So what sort of exercise can help with high blood pressure? Well, the best type of activity is cardiovascular or aerobic activity. These are activities like walking, jogging, swimming, running. In fact, any activity that increases your heart rate is considered to be aerobic or cardiovascular exercise. So what exercise is going to be best? For most people, walking is the obvious choice. Research has shown that brisk walking for 30 minutes a day increases longevity. Strength training can also reduce blood pressure, but it doesn't have as big an effect as cardio. Exercise Sports and Science Australia recommends getting at least 150 minutes of moderate exercise a week. Or that can be 75 minutes of vigorous activity, or a combination of moderate and vigorous activity. So remember, if you can't set aside 30 minutes every day in one block, then try breaking it up into 10-minute blocks. You could go for a walk in the morning for 10 minutes, a brisk walk at lunchtime, and another walk in the evening. Easy, 10 minutes, 10 minutes, 10 minutes, 30 minutes. There's also a correlation between how much we weigh and blood pressure. So physical activity is one way to help us lose weight, thus reducing hypertension. And as most people have found, being physically active actually helps us with diet and weight control. The overall benefits of exercise for your cardiovascular system are substantial.